And good morning, everyone. As we begin, everybody signing on, I'll ask that everybody in the chat put your facility name and your the individuals who are participating so that everyone receives their credit. Both administrators see credits and nursing credits are available. And if there are any physicians, physician credits as well. So want to be sure that everybody gets credit for their participation today. So we'll give just a moment. Seeing lots of folks on the front lines with masks and face shields, and looks great. Busy time for all of us, I know. Again, as I see everybody logging in and connecting with audio, visual, and for those who have camera capability, please put the name of your facility and the individuals who are participating so that we can keep the track, the registration for the purposes of continuing education credits and your facility credits. Great. And just to remind everyone that these sessions are recorded. And so if there are individuals who can't participate in one, they can view the recording later. So I want to be sure everybody is aware of that. Okay, I think we've got the group together. So good morning. I'm going to start. Oops, we have a couple more centers that are logging in here. Good. Okay, I'm going to share my screen. Oops, let's get my email out of there. And let me, and for today, before we get to today's session, and your Genesis leadership has asked that we spend, we change our focus today and have some time to talk about the vaccines rollout. But before we do so, we're going to start with following up from last week. Last week we had talked about staff well-being, and we had asked each facility to, each participant to go and poll your staff and ask about their concerns for themselves and their team members, as well as the residents they serve, and steps that are being taken now or could be taken now to address those concerns, and then to celebrate the good things that are happening within our facilities and our lives as we hunker down for this last surge, what we hope will be the last surge of COVID-19. So I'm going to ask facilities to unmute individually and share your responses to these questions. So who'd like to start? And do remember that you have to unmute your microphone because everybody's muted.
Hi, I'm Tina. I'm from the Wayne Center.
Hi, Tina.
How are you?
I'm doing well. Busy day here in my chronic vent unit. I bet you're having a busy day as well, right?
Yes, every day is a busy day.
Mm-hmm.
So I talk to a lot of different staff. I talk to our maintenance director, our medical records, a CNA, our admission nurse, and I also talk to our dietitian. So I was kind of surprised to see that a lot of them had the same reoccurring concerns. For one of the concerns in regards to the residents was that about their isolation and about
Mhm.
them not being able to leave their rooms and, spend time with other residents, and that, we can visually start to see that there's been people declining because of the social isolation. One of the other things that came up was their concern is that the residents are not able to see their families around the holidays.
Mhm. Mhm.
I mean, they have FaceTime that we do, but it's not the same.
No, it isn't. It isn't.
One of the concerns, one of the reoccurring concerns that they had for themselves was staff burnout.
Mhm.
And, they feel like everybody is chipping in, now that we're doing testing several times a week, we're using our medical records, we're using admissions, we're using a little bit of everybody. So not only are they doing their jobs, but now they're doing more jobs.
Mhm.
And, they're concerned. And although we've been very lucky that everybody has, really been on board and they pitch in wherever they need to be, we have a lot of staff that are working 10, 12-hour days.
Yeah. Yeah.
Um, One of the concerns about their self, interesting enough, is also the same theme, that they're afraid to either come to work and infect somebody without knowing that they're positive, or that they get COVID and bring it home to their families.
Yep.
So that's been a recurring theme. One of the things that they said that would help alleviate some of their concerns, especially staff burnout, which I found was interesting, was to, when we were in the surge of the first round of COVID, we did a lot of lunches for the staff. So that was one less thing they had to worry about when they came to work. They had lunch every day, and it was a hot lunch.
Mhm.
So they talked about going back and providing lunches again for the staff, maybe doing things like a food truck.
Mhm.
It doesn't have to be every day, but if you did it one day a week. We, in the beginning of COVID, when we had the surge, we had our recreation department would come around and stop in front of each one of the rooms and had snacks and juices that were not normally found on the menu. So they would go to BJ's and they would get chips and they would get tasty cakes and
Mhm.
things that they missed from home. And we saw that those residents that partook in those kinds of snacks were starting to gain a little bit of weight because they weren't in the routine of, just eating the 3 meals a day.
Mhm.
Um, so they brought that up. One of the reoccurring answers to every one of the questions about what good thing happened today was that our staff tested negative.
Yeah. Mhm. Wow.
So that was, I mean, it's something that some of us take for granted, but that was one of the things that really stood out for every person that was interviewed this week.
Wow. How powerful. Oh my goodness.
Yeah.
Um, were you able to share your your informal survey with your leadership and
No, but that's something that I'll try to do tomorrow.
yeah.
We've been focusing on the vaccine
Oh yeah.
and educating our staff in
Mhm.
regards to that. But I think going over something like this is a real eye opener.
Absolutely. Wow. Well, thank you for kicking us off in such grand style.
Sure.
Uh, I know that took you a good bit of time. As you said, we're all doing double duty. But I would bet that your staff really appreciated that time that you spent with them and hearing their concerns in a kind of what I would call an informal, low-key way, one-on-one.
Yeah.
Thank you.
You're
Thanks.
welcome.
Anyone else find similar types of answers or different responses from your staff? or for yourselves.
Okay. Hello.
Yes, good morning.
Hi. This is Martine from Chapel Manor,
Mm-hmm,
and I would like to answer the bottom question: what good thing happened today?
mm-hmm,
And Tina said that the staff, um, a lot of the staff is testing negative, which is a good thing. But to me, I think us waking up every morning is one of the best things ever, because if we're watching the news or knowing anyone who's lost family members or lost loved ones, or just us watching the news, period, to see that people are losing their lives, to me, the best thing every day is waking up and being able to come to work, or even hug your family, or even tell your loved ones that you love them.
yeah.
To me, is the best thing ever. And we all should not take that for granted.
Well, thank you, Martina. You're talking about supporting each other and celebrating some of the little things in life that, um, and given that we can't go out and about and have some of the luxuries that we've enjoyed for so long, but what's really important is what you're describing, right?
Yes.
Yeah, good, good.
And the second question, are the steps we can take right now as a team
Mhm,
is, I would love for our facility to continue educating people and letting us know what they're learning on an everyday basis, so everyone's mind could stay at ease, because they're learning so much from the CDC. And I would love for them to always continue passing that down on to us so we can know what they're finding out from the CDC, just to keep people's mind at ease.
mhm. That's
And
great. And that is part of what we should be doing once a week. And uh, the IHI has helped us with the links for some of the CDC updates. But I share your recommendation there. And indeed, our little hour sessions once a week, we'll be sure and highlight what's new. And I think we're all beginning to feel more comfortable saying, new knowledge, things change. I'm okay with change because change is giving us new knowledge, and therefore we can respond better and address COVID more effectively. So I'm getting comfortable with change. How about you?
yes.
Mhm,
Yes.
mhm,
And what concerns do you have for residents? The only concerns is, before COVID, they were able to see their family. Yes, I understand Zoom is available for them, but hopefully soon they will be able to love and touch on their family members.
yep,
Um, for
mhm,
myself, I just would love to continue doing what I'm doing, COVID free, not bringing it home to my family, not bringing it into the facility,
mhm,
and for the team, for us to all stay strong and
mhm.
continue doing what we're doing on a regular basis to care for the residents.
That's great. That's great, Martine. Uh, we here at Johns Hopkins this week have made a big change in our break rooms and our shared spaces, nursing stations. We have large rooms where our different team members will sit and use computers. And just this week, we've made a statement that no eating or drinking in those rooms. You know, we're all used to having our cup of coffee or our bottle of water right next to us. But with new knowledge about the rare spread from staff member to staff member, but where they're happening is when people are eating and drinking in close quarters. So we've gone through our entire facilities and we've identified space for people to eat and drink and take breaks, worked on our schedules so that people do get breaks off the unit and they go to these spaces and have some quiet time where you eat and drink. That's a huge change for all of us here, but it is a way that we've identified a new step to keep us safe. So just wanted to share that with you and what's new for us here. But it's challenging, particularly when one is working on a COVID unit and having to take off all the PPE, put it back on. But that's what we've done. That's what's new for us today is our new step to keep us safe. Uh, Other facilities that have any anyone's just validating what we've talked about so far, or new information from based on the concerns your team has reported or that you have?
Hi, it's Melanie from Crestview Center over in Langhorne.
Hi, Marie.
So just, adding on to the common themes, a lot of feedback that I received here, mainly talking about, steps to take to especially help with communication, just because there's so many changing pieces that's coming out daily. So that seemed to be a common theme. And I do think we do a pretty good job of that here at Crestview. But again, always making sure that we get every single piece of information down from the management team all the way down to direct care staff across the departments. And then in addition to that, the good things that have happened, we've been able to resolve a lot of our COVID positive residents between last week and this week. So that seemed to be, for us, just a revolving theme. So very good news.
That's great. When you say resolved, you mean they've improved clinically and are not sick?
Correct. Not symptomatic and, symptom-free for a period of time.
Yeah, that's certainly something to celebrate. Melanie, can I ask you about the steps you're taking for communication, different strategies, more than one strategy to get the word out when changes occur?
Of course. I mean, we do a morning meeting via Zoom every morning. That's with all the department heads. And then we do bring it back to the different units in the building. And then we make sure that the unit managers do speak with their direct care staff as well. And that's just all across all departments. And, throughout the day, we'll get different types of emails with updates. Perhaps it's phone calls. We did get suggestions, though, when I did ask staff, and they, responded that possibly posting memos throughout the building. So that's something that we are taking back and considering.
So it sounds like multiple strategies, emails, huddles,
Yeah.
Zoom meetings. So anything worth hearing is worth hearing more than once, is I think what I'm hearing you say. Good. We are, we're going to talk about shortly about vaccine preparations. The amount of communications and the different modes of communications here amongst Johns Hopkins staff, very impressive this week. Trying to get the word out, everything from a town hall meeting by our dean of the School of Medicine to emails from our department, and then within our individual units, we're getting then emails from our unit leaders. So everybody's weighing in, and what the challenge I see with that is everybody saying the same thing. And so far, yes, and so I appreciate that those who are getting the word out are being very thoughtful to be consistent in the word, so that we are hearing it multiple times, but not being confused, but being reassured. Okay, any other facilities want to share your good things that happened, or in particular, any concerns that we haven't brought up yet? All right, I'm going to switch my share right now, and I'm going to take a moment now to show, actually I do see within the chat, Diana at a chapel, residents' mental health and isolation, and the steps are communication and support. So that's certainly very, very important. And thank you, Diana. Ramos mentioned that you actually enjoyed asking these questions. So having an opportunity to discuss their concerns with staff members. And I want to highlight, Diana, can you get on and actually share your experience with your maintenance director? Are you able to unmute? There you are.
Can you hear me?
Yes.
So he was actually one of my favorites. Very chatty this morning. His biggest concern was to ensure that the residents were comfortable in their room. and just stopping and talking to the residents. He said that we need to go back to the simple things, and that staff are so overworked and overwhelmed that they're just forgetting to say, hey, how are you? What can I do for you? And coming from him, I just thought that was he's such a great guy anyway. And his good thing that happened today, he said, I got up, came to work with a smile like I do every day. So, yeah, I enjoy this. I can't hear you.
Thank you. Absolutely. And hearing it from not just our direct line personal care providers and nurses, but everybody in the facility, and recognizing everybody's role in our successes. So that's great. And David Scarantino, you mentioned also the thankfulness for being able to work and to be healthy and to be able to have a very important role right now. So I agree with you there. And also talking about everyone chipping in together in your facility and the group powwows. I like that term, powwow, instead of huddles, so that everybody's informed and knows their role and can share their best practices. So terrific. All right, I'm going to share my screen again because I want to be sure that we now want from you the same type of feedback on this program that we're doing. So Project ECHO has developed a very short survey for all of the participants who are doing these sessions once a week. So I'm going to put this link in the chat box, but it's before I do so, I'm actually going to open it so you can see it. So it's a very short online survey asking for your feedback. And through your responses, we'll be able to do even better working together to strengthen all of our resolve as we get through the next few months of our COVID-19 response. So please take a moment and complete the survey online for Project ECHO. This is a huge effort, and very thoughtful people are trying to make a program that works for us. So please share your feedback in this official forum, okay? So I'm going to just take a moment and get that into the chat so that you have that. So here's the link, and I'm just going to copy it right in front of you and put it in our chat box. Oops, sorry. And let me get everybody there. And there it is for you, okay? So if you just take a moment to click that link and take care of that survey, we'd greatly appreciate that, okay? All right, now I'm going to share my screen again and go to our lesson plan for today. And actually, before I do that, I'm sorry, the official lesson plan is on building a safe environment. But before we do that, your Genesis leaders really want us to spend some time in preparation. So I am actually going to not share that right now. I forgot. And what we wanted to do first today was address concerns regarding vaccination. And let me share with you where we are here at Johns Hopkins with vaccination. So we actually have this week distributed to all of our employees at Johns Hopkins Medicine the information that our best leaders anticipate approval of the Pfizer vaccine this week because they, in fact, have reviewed the data and feel that it's compelling in terms of effectiveness and safety profile. And they've already announced to all of us how the vaccine will be rolled out. And that they anticipate the vaccine will be here at Johns Hopkins by early next week. And so they've set up clinics already for next Wednesday. Now I know that, I'm not on the national news right now, so I know things could change, but the fact that our leaders are saying, this is what we anticipate, we recognize that we are not in charge of the country and this could change, but we want you all to be prepared and to address the concerns you might have regarding vaccination and to educate on how it will be distributed. So let's talk about it now so that we're ready when the vaccine is in our freezers. And in fact, the freezers, we've seen pictures of where our freezers are. So we all know the preparations that are underway. And I wanted to share with you how we're rolling it out. We have more direct care staff than we will get vaccine. We already know the number of vaccines that we will get in our first shipment. It'll be about 1,000. But we have many more direct line staff here at Johns Hopkins Medicine. So how we're distributing it is every employee is being asked to complete a questionnaire, a very brief questionnaire, and we're doing it through our electronic health record because it is a very secure portal and we all have access to it. And tomorrow morning at 8 a.m., we will all get an email message inviting us to go into our patient portal and complete this survey. And the survey asks, are we frontline, are we, whatever our duties are we conducting those duties in our COVID units? Because we do have units that have been repurposed that are biocontainment units for COVID. Do our duty, each individual, are your duties there? And the next question is, if not, do you have direct care of patients in an inpatient setting that is not COVID? And then the third question is, do you have outpatient? Because our leaders have determined the highest risk employees, regardless of what you do, is do you spend time in a COVID unit? And then we recognize that even though we try to isolate and use our biocontainment, there are patients who arrive who are not considered to be COVID and who do develop COVID. So that's why our inpatient is non-COVID units are our second tier. And then our third tier outpatient, because we do screen in the outpatient setting for COVID symptoms. And what we've been told is that our first group of vaccinations will then be a lottery of everyone who's in that top tier of COVID care and the second tier, because enough inpatient exposure, and just like our nursing facilities, we see COVID positive residents in the long-term care facility, not just in those that are short stay. And so there will be a lottery on Monday morning. So everyone has between Friday morning and Monday morning to submit their questionnaire. And the first question is, will you accept vaccine when offered? And then it will be offered based on your tier, and then a lottery, because we anticipate that we will not have as much vaccine as we will have interest in receiving vaccine. And then as more vaccine becomes available, they will continue this process as we get vaccine as more individuals, and then going down further in our tiers. So I wanted to share all that with you just to say an example of communication and effectively distributing the vaccine. And then we also have on our intranet, we have videos of the individuals who've done the vaccine research sharing their actual results with all of us. So as if we were part of the FDA advisory committee to review the data. And they're presenting the data at a level that really is less medical jargon and more understanding of, here are the number of people in the study. These are how many people developed symptoms and were known to be positive in the group that got the vaccine, didn't get the vaccine, showed how common, what the common adverse experiences are. So they're really videos for us to see the action. We even saw videos of where the study visits were conducted. Turns out the parking lot where I normally park my car here at Johns Hopkins was repurposed, and temporary buildings were put up, like tents, and within those tents are exam rooms. So they actually took a video and showed individuals who gave consent for this, and we saw people being part of the research studies. And it was funny, I could see my usual parking space and where it is and outside the tent. But it really, and I tell you all this because I believe the purpose of all of this is for us to feel comfortable with warp speed development of a vaccine, because we have a lot of discerning people here who say, maybe I want to wait and see how this goes, as opposed to be the first to be in line. And my response to this type of communication and education is that more of our staff will be completing that survey at 8:01 tomorrow morning, and hoping that they win the lottery and will be the first vaccinated next Wednesday. So I share all that with you as a preface for us to discuss what are you hearing amongst your staff? What are your concerns as vaccine we anticipate will be rolled out very soon. So who would like to start this discussion? Erin, I'm going to pick on you because I see you there in your leadership role. Tell me what Genesis is doing in preparation for vaccine.
They really have launched a significant campaign to try to get vaccine acceptance. So, setting up some Zoom calls with our medical directors leading them, specific communications that we want to target to our patients and family, and some guidelines and some tools to help that happen at the center level. And it's really been a crazy fast process. So, past 2 weeks, we kind of got really up to speed on, the vaccines, and, this is going to be a go. So it's a quick thing. And I think centers are probably with fast, all these things. But, we're trying to get the information out because obviously the vaccine acceptance is crucial. We have the opportunity to be the leaders of the end of this pandemic. So I think that's pretty neat. And I think that's what we're trying to drive home as a company and a corporation. And so we could be the leaders and help our country get out of this pandemic that we're in.
Here at the facility level, the discussions you're hearing about vaccine.
This is Rick from Harston Hall, and the main question, we're having discussions with the staff about the vaccine, but the one question that keeps on coming up with my staff is long-term effects, which obviously nobody has an answer for. And what if you were COVID positive already, do you need it? And what if you're pregnant or trying to get pregnant or anything like that? Because there's been a ton of news articles, which who knows what to believe about infertility issues and all that. So that has my staff scared. My older staff in general are more nervous about it because, one complication, one thing unknown. So I think it's more the unknown that scares them and the lack of information.
Very, very valid questions. And you know what? The same questions came up in our town hall meeting at Johns Hopkins. I can tell you the responses from the vaccine experts. If an individual has had COVID, they are still eligible and encouraged to receive vaccine because they are not fully comfortable saying that infection enough will build enough immunity to continue preventing a reinfection. While certainly studies are going on and we're using convalescent plasma in treatments, at this time, the recommendation is to be vaccinated even if one has been COVID positive. That's similar to what we recommend for Shingrix. So even individuals who have had shingles, we, after their shingles have healed, we encourage that they be vaccinated if they were not vaccinated. And in fact, because Shingrix is a 90% effective vaccine, it's likely they were not vaccinated before or they would not have had their shingles. So that's a very easy one to discuss and talk with staff. The pregnancy, there are studies now going on to address sufficiently. So there is not an answer, and at this time, pregnant women, I believe, are not going to be vaccinated in the first wave. Anticipating pregnancy is a much different topic, in my opinion. And being vaccinated, if one is able to plan that pregnancy for, I would say, a month or two after that second vaccine, to me, in some ways, that's protective. And so I believe most obstetricians they are not, and they will not be offering vaccine initially to women who are pregnant. But in planning pregnancy, vaccination now, particularly if you're a healthcare worker, may be an appropriate step for individuals. So that's a tougher question to answer. I do know that they're beginning to address that formally with data, but we don't have that answer yet. And then your comment about the long-term effects. And that is true. And they are continuing to follow the vaccine study participants for 2 years, but we don't have the data for the 2 years. In general, though, historically, vaccine trials, the most common and most significant adverse effects are early on and of the sufficient time period for which the vaccines have been studied. And while there are no guarantees, we do know that 12 out of 100 individuals who have COVID are sick enough to be hospitalized. So we do know and we know the death rates in particularly older adults or those with active medical conditions. So when we weigh the unknown of the vaccine long-term with what we know about the infection, most of our folks who weigh these data are supporting vaccination, and particularly for healthcare workers who are at risk. We're in the high risk group. But thank you for sharing the concerns you've heard, and I hope we've begun to have a discussion of those. What other concerns are in your individual facilities are you hearing as you begin to talk about vaccine?
Dr. Bellatoni, I just wanted to bring something up that I think maybe Rick had kind of touched on. So I think would be helpful is how do they combat, the social media campaigns of all the misinformation that's out there in regards to the vaccines, which is where I would venture to say a good greater than 90% of our staff get their information from, unfortunately. So we have to combat that at a center level as Rick pointed out, there's lots of things going around about fertility and, other things like even microchips in vaccines. That's, completely outlandish. But unfortunately, our staff feels this and, our direct care staff, some of them actually believe it. So I think a good discussion would be, how do you combat the social media flood of information that is so inaccurate?
Yep. Well, as I said, what we did here at Hopkins was we had the experts give their data. They presented it just like we're in a Zoom right now. Anyone at Johns Hopkins could log into the meeting and see them present. The CDC, I'm certain, will have a similar type of video presentation. I'm finding that more and more of our national news media are beginning to be more pro-vaccine and share. Again, they're bringing this morning on the national news, and I do watch it because I want to know what my staff and my patients are seeing. And the chair of the FDA was on this morning and very calmly walked through the process. Who are these individuals who are reviewing the data? The chair of the committee was on to say, we have the raw data and we have been holed up in our offices with our computers analyzing the data as if these were our studies. We know how important this is and we want the American public to know that we're doing our job. And this morning, the big highlight for many of the news media was the fact that there were a few vaccines in the UK, vaccinated individuals who had allergic reactions, anaphylactic reactions. Very rare, but those were individuals that were known to be at risk for anaphylaxis who carried epinephrine pens with them because they have that risk. And in some ways, to be able to say, we know there's risk and there's benefit. Benefit outweighs risk, but for those who have severe allergic reactions, maybe you shouldn't be the first to be vaccinated. And if you are if you do choose because you're a high-risk healthcare worker, you need to have your EpiPen ready because that's how you manage your allergic condition. So talking about all of these things and acknowledging what we don't know and how we're getting to what we don't know, but to talk out, again, that balance of benefit and risk, I think is a very important discussion. Anyone in your facilities having other strategies that you're thinking about as you begin to have the vaccine coming to you?
This is Mike Melling from Edge Hill. Genesis has, at the leadership meeting, national leadership meeting on Tuesday, laid out a very definitive strategy. And it really begins with a letter from the medical director. There was a template that was given to us to work with the medical director on. That's going to go to residents and family members, along with a AMDA question and answer about COVID-19. And it'll be out either by email or overnight. Not overnight, but by U.S. Postal Service delivery if they don't have an email address to all residents, obviously here, and then the family members. That's step one. That'll be by Friday, tomorrow. By next Wednesday, we have guidance in terms of a family Zoom call that we'll be scheduling. Ours is going to be scheduled for Monday at 4:15 in the afternoon. That'll be attended by our medical director. And on that, there'll be presentations by the executive team at Genesis talking about the vaccine, as well as a PowerPoint called COVID-19 Vaccine Hesitancy and Education. Now is the time, by Leslie Ebler, MD of the CMD, and trying to get as much information as we can out at that family Zoom meeting on the efficacy of the vaccine, as well as the safety and the questions and answers. So we're trying to take those myths and misinformation out of the picture by providing objective information by the CDC and other experts on a very objective basis.
Great. So it seems to me that your Genesis leadership is doing just what our leadership here at Johns Hopkins is doing, which is leaders who are respected are presenting the information and willing to address the questions. In your Zoom meeting, will there be questions and answer opportunities?
Yes, there always is with the family Zoom meetings an opportunity for questions and answers. And that will review all the documentations as well as the PowerPoints and the video presentation by the Genesis leadership team. And then Dr. Keller, who's our medical director, will be on that call as well to answer any specific clinical questions.
Good, good. And in our rollout, there were a few questions in our question answer session that the person in charge of our vaccine rollout couldn't answer. And she was very comfortable in saying, I don't have an answer for that today. Great question, obviously, and I will distribute an answer as we make a decision on this particular issue. And it was a nuance of our tiers of staffing for the lottery, so being able to admit if there's something that is not fully established yet and why it isn't is another important. So it isn't just we overlooked this, but this is a more challenging decision to make, or having some thoughtfulness to those answers. I think in the end, the question and answers are as critical as that basic information that's presented initially, because it does say where might we fall short in our success of vaccination. The folks who ask the questions are the folks who are often on the fence and trying to make a decision, an informed decision. What other questions are you hearing? That I'm going to share one with you was my own father on the phone this week said to me, so if you get vaccinated next week, if you win the lottery, will you not have to wear a mask anymore? I said, have you not been following the infection prevention of, I said, of course we have to wear a mask, that, The vaccine, first of all, will take some time to be effective. It's more effective after the second dose, not just the first dose. And that just like influenza, you may still get infected, but it would be a milder case. So our goal is not to be infected, and because not everybody will be vaccinated, the answer is everyone who's vaccinated will double down on their mask wearing. Not that we're concerned that by having the vaccine you could spread the virus. That is certainly not true. It is not a live virus. But just saying the infection prevention measures continue. Kelly, you share in the chat a very significant concern that you're feeling your staff and your residents will accept vaccine, but that the community in general will not, and you're concerned about that need to get to herd immunity. And I share your concern there. I expect those who are most informed about the seriousness of the virus and health measures will be the folks first in line when vaccine is offered, but we need widespread acceptance of vaccination. Anyone have any thoughts on how we address the community's response to vaccine and support the community in vaccination? I see, Joanna, you're seconding Kelly's concerns as well. Do you have any thoughts on how we get the community to be on board?
I think just being open and communicating about how important it is, and if we hope to return to a place where we can have more normalcy in family visitation, where they might be able to come into the buildings more than they are, then vaccinations might be a really serious consideration for what we can do. I don't know what will end up happening with regulations and policies down the line, but I foresee whether or not someone has a vaccine might be an important part. Whether or not we're able to ask that, I don't know. Ethically, are we able to ask them if they've been vaccinated? I really don't know the answer to that, but it is, prior to COVID, family members were a huge presence in the building, a lot of foot traffic, a lot of presence. And while we are doing our best with modifications to honor and continue that, I would be concerned that we're going to go through vaccinations for staff, we're going to go through vaccinations for residents, but then if the family members aren't also on board with this project, that's a third, a big presence in the building that's not in alignment with our goals and our direction that we're moving in.
And I'll add to your great comments that if we're successful with our staff vaccinations and high acceptance of vaccine, that will set an example for the family members as well. So, yeah. The vaccine is not mandatory. And at this time, although there were some discussions on the national news this morning, our understanding is because it will be under an emergency use authorization, it actually cannot be mandated at this time. Should that change and it no longer be an emergency use authorization, then indeed healthcare facilities could mandate that their employees be vaccinated, just as we are currently mandated for flu vaccination, with very few exceptions. But nobody's going there right now. So it really is the understanding of the benefits, risks. Again, I do this a lot when I'm talking to a patient about benefit of a medicine versus side effects of a medicine or a treatment. So I do the same for the vaccine and try to show individuals that I find the vaccine benefits far outweigh the potential for adverse experience. But I'm also being honest with people. Your arm will be sore, but if you know that going in, we can manage, right? We do a lot. We're getting up every day and being here on holidays and nights and weekends. So we can all tolerate a sore arm. And if we get a little bit of fatigue or a little bit of a low-grade fever, we'll understand why, and we'll take our acetaminophen and move on and make sure we're well hydrated. And for those healthcare workers who truly have anaphylactic reactions, they may not be the first, but if all the rest of us, that's a very small number of us, if all the rest of us are doing our part, we'll get that herd immunity within our workplaces pretty quickly, as quickly as we can get the vaccine to us. Anyone have any strategies you're thinking about as you roll out vaccine to your staff? We've talked a lot about giveaways and things like that, and I think we've all decided we're not doing that. The giveaway for us is winning the lottery to getting the vaccine. Are there challenges in where you might have your space to do the vaccinations in your facilities? Nope, I see a lot of folks shaking their head no, so you've thought about this. Good. Are there any concerns regarding vaccination that haven't been brought up yet that you're thinking about or you're having trouble finding a strategy to address? New admissions, thank you, Kelly. And having access to the vaccine ongoing so that you can vaccinate your new residents and your new employees as well. And there will be strategies for that. As more vaccine is manufactured and becomes more readily available. I recall the Shingrix when it first came out, and as we looked at the data and how compelling it was for prevention of shingles, far superior to our prior vaccine. I had my patients calling their local pharmacy once a week to see when they got new supplies in, because it was just, as soon as it came in, it was gone. And so at some point we'll get to a steady state of vaccine availability, and now there's no wait for Shingrix in Baltimore, but there was when Shingrix first came out, and I do hope we have that. I would say I hope. I want us to have enough vaccine for all of us, but we know over the next few months the rollout will be based on availability and manufacturing. Okay. I'm going to then share my screen now, and if there are any other thoughts, Jody, you raise a very important point about short stay residents who get vaccinated and then are discharged before the second injection. That's also will be a logistical challenge at the time, at least initially for the next month. After that, though, the national rollout with Walgreens and CVS, I believe, will make it possible for our short stay residents to get their first dose on admission to your facility, and then get their second dose at their local Walgreens if it either 3 weeks or 4 weeks, depending on which vaccine they're ready for their second dose. So it will be one more step in our discharge planning, but I do believe we'll get to that in a few months. Okay. And coordinating staff vaccination to avoid staff shortages based on symptoms. And in fact, part of our lottery and our reason for doing remember I told you about 2 tiers, tier 1A, that will get 60% of our first doses are in the COVID units, and tier 1B is the non-COVID units, is so that not all the staff in our COVID units will get vaccine on Wednesday. There will be some folks who will have enough symptom that will feel that they can't be on duty that day or the next day, and we do have those concerns as well. And so because we don't know, we are in fact with our approach to the lottery and the different tiers, not everybody on the same unit will get vaccinated the same day, at least initially. If we find next Wednesday that everybody's on duty Wednesday, Thursday, Friday, and there hasn't been any concern, then next round we may do it differently.
I think this is Rick at Artisan Hall. The problem we have here is that we don't have that flexibility.
Mm-hmm.
CVS is setting up the clinic date. It is the date, and that's all we get.
Yeah.
They even said on the call that whatever date they pick, if it's Christmas Eve, that's the date. I don't get to change it. So I don't think we have the flexibility, and we have to get all the staff we can vaccinated. So I don't know what we're going to do because there's no workaround there. unless we waive the sign and symptoms for anybody vaccinated.
Now, when I look at the data, and we've talked about this, we've tried to prepare staff. We truly don't believe that's what's going to happen. A sore arm should not prevent you from working. Fever is the one. Little bit of malaise is a more challenging yes, no. We think it's the fever, and the data are not so compelling for how many individuals will have a significant enough fever for you to say you can't work today. So I think actual checking of temperatures and using that threshold, I believe is, now this is one detail that I didn't hear, temperature of, we have our criteria here, but I believe that if you actually use the true fever, then I believe that we'll be okay with staffing. But
Dr. Bellantoni, one of the things that one of our other physicians and one of the other cohorts mentioned was that it's possible the CDC will publish a testing protocol for post-vaccination that would allow some flexibility to kind of avoid some of those possible side effects. But I haven't seen anything, even any talk of it from the CDC. So I hope that he has an inside track that we don't have, but that could be a really good option for us who are, we're constrained by the CVS delivering the vaccination, that we don't have flexibility, like he said. So and
that's true. Yeah, good point. And in fact, we've now begun here at the hospital testing. Our only testing was symptomatic or exposures, and now we're beginning to offer asymptomatic testing to our employees as we've had more availability and the new modes of rapid testing are becoming available to us. Yeah. Okay. All right, I'm going to share my screen again and go to our actual session 4. The curriculum was to talk about building a safe environment, which we've been doing in our various sessions, and certainly when we talked about how we don and off our PPE in particular. I wanted to share with you the one new issue here. I think I mentioned it earlier in this session. In terms of our safe environment, one of our new practices, and we've talked here about your walking rounds and using your evidence-based tools for quality improvement to observe staff using the safety practices and using their environment safely. But one new issue here that I wanted to bring to everyone's attention is this issue of staff eating in places where there are others. Can I hear from you strategies that you've developed within your environment to address staff eating so that you can have a safe environment in this new era of understanding transmission?
Hi, this is Tina again from Wayne. So what we've done in our break room, we actually took away chairs so that people, there was a limited amount of seating. We also have a break room that is specifically for our observation unit, and we make sure that we're rounding and making sure that there's people at a table that are at least 6 feet apart, opposite sides. That is where they eat. So we have to make sure that they're far enough away from each other.
Great. So it sounds like you're on top of this and addressing this issue of staff needing time to eat and drink and remove their PPE, but to do so safely. Any other facilities that have had thoughts on that regard? And then there's also the challenges of our own patients and their, what we talked about, the first thing we talked about in our concerns from last week that we identified were resident isolation and residents being able to have a quality of life, but safely in our environments. And the case that was presented to us for the curriculum was talking about in a memory care unit, the usual activities of dancing and being together, holding hands, sharing music, singing. And obviously we're not able to do that now. Any strategies that you've developed to have activities that, and I'll share with you some of the ones I heard in my Tuesday cohort, but let me hear from you how you're using your environment to address quality of life for residents.
One lady, this is Martine. I play Christmas music for the residents because I do it for myself at home. As soon as I get in, I turn on the radio to B101 and play Christmas music. And I think, I mean, Christmas will be totally different this year, but it's something about that music that brings joy. So I think playing music they like. Right now I'm playing Christmas music for them. So I think playing music or music they like is some, brings some kind of joy.
I learned a new term, doorway bingo. One of our facilities on Tuesday talked about that individuals are in their doorways and they're calling bingo from the end of the hallway. So that's a new phrase for me. Any other strategies that you're developing to address the resident issues of the environment? Okay. So there's a new resource in our quality improvement for today, and that's a term called psychological PPE, and talks about how the individual can prepare themselves in their time off to, in fact, get out and exercise and be outdoors. And looks like this weekend here, at least in the Maryland area, we'll get a little reprieve from the cold, and hope everybody can have some time outdoors the next few days. And sometimes to shut off the media because in fact the media can really be more than what we can all handle. I think I can make this a little bit bigger. Oh, I won't go there now. And that we as leaders of the facility are certainly modeling healthy behaviors for our mental well-being. So with that, what I'm going to say for this week is I think we're all gearing up for vaccination. I think we've done a nice job in our session today identifying our staff concerns, our own concerns as we make these thoughtful decisions, and that our leadership for our facilities, in fact, have a plan in place to educate and to implement vaccine, and not so easy vaccine given the cold temperatures that the initial vaccine. Great. So I want to hear from all of you. I actually thank you, Johanna, for saying you're doing doorway bingo as well. I remember the deer hunting in Pennsylvania. I'm sorry to report my 87-year-old father and his 85-year-old brother did not get their deer this past week, but I did hear about their day-to-day hunting activities. But that you're doing replicating the deer hunter video on Facebook. So it sounds like you're doing a lot of good, appropriate, fun things in your facilities to make us all be as comfortable as we can. So with that, I'm going to say be safe, and we will meet next week, and then after that we will take 2 weeks off for the holiday season. But I'll see you all next Thursday, the 18th, and till then, be safe. Take care.
Thank you.
Thank you. Bye-bye.